Let's see.
Hey
So I,
Mo,
hey, Ricky.
we're live.
We are. The doctor is in on
The
YouTube,
doctor is
baby.
in on YouTube. We're doing it on YouTube. Isn't that so
Hey,
cool?
Mo. Hey, Ricky.
There it goes.
We're live. While
We
you do that,
are. The doctor is in on YouTube.
I'm going to figure out how to man the chat. So we just
All
take a
right.
quick second. We'll wait for people to join us.
Yeah.
And yep, we want to get your questions and comments live. So we're going to be manning the chat. So
Give us a minute to try to get this together, right? Right. New technology. And we have our new badass friend another friend I picked up somewhere that I love to do. Dr. Claudia. I look, she even knows how to make her heart. Dr. Claudia, I met her at Dr. Laura Esserman's Rise Up conference. You know, Dr. Esserman does this conference where she basically created her own sort of San Antonio breast cancer conference, only it's better. It's focused on women's health and it's so good. And Dr. Claudia was there. We had like a little group, didn't we? That we
Did.
felt kind of formulated. And so introduce yourself. Tell us all the wonderful things that you do, and then we're going to talk.
Okay, wonderful. Hi, everyone. I am Dr. Claudia Davis, and I'm a breast cancer researcher. I have been studying survivorship forever. I really am interested in the point where women are diagnosed, and from that point on, right? Because the treatment is standard, but yet what happens after survivorship? And there are some evidence to show that it's very different for women that look like all of us here. And so I'm interested in that, and I'm really excited to be here. My journey has always been breast cancer survivorship. I worked at a hospital, and I had, to tell you the truth, I had two individuals that um, were diagnosed with breast cancer, and I got to know their families. I got to be one-on-one with them, and I lost them. I should say we
Mhm.
lost them. And that really left an indelible mark on me because I thought they were too young to die. One was an actress, one was a ballerina. And
Wow.
I wanted to really make an impact. And that I'm working for all the women that are diagnosed, all the men as well. There's a small number of men
Amen.
too.
Yeah.
a
And so
growing number of men, though, you know?
Right.
But those
Right.
outcomes, when you look at what's happening, the statistics for men do mirror those of Black women. So it tells you something that is systematic and structural and pervasive and not just the biology of things. But um, you're so right, Doctor. Can I call you Dr. Claudia? Is that okay?
yes, please.
Okay. Dr.
Yes.
Claudia, because when you look, I was at the Society of Breast Surgeons meeting in Seattle this year, and there was a pre-meeting course on cancer exercise and nutrition and integrative therapies. And you know what was missing from the conversation, from the panels, from the data?
Yeah.
Us and the
Right.
research, right? We need to be doing research with us on these topics, and it doesn't always happen.
Right. You are 100% correct. It doesn't always happen, but that's where the rubber meets the tire, right? The road meets the tire meets the road, if you will. That's where we need to really have an impact. So, yeah,
Yeah.
I agree with
And
you on that.
we know we have a different disease biologically and all the things, but I think we also have a different disease emotionally. And we talk about the Black woman in the purple cape and and all the things that we deal with as Black women. And so I think our mental health needs
Mhm.
are different and need to be addressed. I was just at a meeting, Mo, with one of our favorite pharma partners, and we were talking about survivorship and what that looks like. And they made a lot of assumptions about people learning about survivorship right when they finish their treatment. I'm like, you have no idea what survivorship is. You don't even know you're a survivor yet. You know what I mean? But at what point do you really know what survivorship is as a thing? It's not until you get that stressed out day or that neuropathy or that just like emotional breakdown. Holy shit, where am I today? You know what I mean? Or that different kind of fatigue you've never had before because it's emotional fatigue, right? But there's so many things, and I'll let you speak to your research, but I mean, I had no idea what survivorship was until probably 2 years down the road, right?
Right. Absolutely. So I will share that for some women, they're into survivorship from day one. Like, okay, I'm going to beat this. Okay, I am going to beat this.
Yeah.
So they're in that mentality. And at the same time, you also find out that it's a journey for some as well, right? And that you have individuals, for example, I work with breast cancer survivors in the community, and one of the individuals told me, she said, everyone is concerned about this, and she was doing her breast as this, but she said, but no one is concerned about what's here, right? So what psychologically is occurring. And you're absolutely right with regards to the effects of chemotherapy. You have chemo brain, you have your fatigue, yeah, right? And so there are multiple factors that come into play. And then you also have the fear of recurrence as well, right? That's in the back of your mind. And so
Never
that's
goes
stressful.
away. It never goes away. I'm almost 15 years out, it never goes away.
Mm.
Yep. Scanxiety is real. And Dr. Claudia, you're right when you say that it is defined differently for different folks. And some of us give a definition to our patients. Survivorship starts at day one, right? And so my patients come into this knowing whatever your stage, whatever our journey is, this is the time that we start focusing on survivorship as a journey, not as a destination. But many others are taught that survivorship happens when you ring that bell, right? And then it becomes this sort of magical place that you get to eventually if you're lucky. And then after that, everything's supposed to be okay. And their family members are like, well, what do you mean? You rang the bell. And I feel like there's so many different even definitions of survivorship.
You are 100% correct, right? So you have the body of research that says that individuals don't really like the word survivorship. It's thriving. We are
Really?
thrivers, right? Oh, yeah,
Yeah.
we are thriving, right?
And
And
is that
so,
stage four or not just stage four? I'm sorry to cut you off, but I'm so
yeah,
curious.
yeah, it's a concept, right? So you have
Yeah.
individuals that, and research that shows that it's for some individuals, it's a pebble, it's a pebble in the on their journey. It's small, it's not a big thing. But for Black women, in one study that I have done, they do define their journey as survivorship. It is defined as that, fully survivorship, fully understanding that word is embraced more so than other individuals. And so we recognize that there could be other factors too, right? Because you have other competing factors that are occurring. And so that survivorship is really embodied in women that I work with.
Wow.
Mhm.
Wow. I remember when I first was trying to figure out if I was a survivor or not, everyone said it should be when the cancer was removed from your body, which was my mastectomy, right? But back then we did mastectomy first for triple negative before chemo. Now, with the protocol for triple negative is you basically are doing chemo for 4 to 6 months before you even have the surgery. So I kind of changed. Okay, survivorship is the minute you're diagnosed, you become a survivor. But that still doesn't tell you what survivorship is really, because then you sort of finish your treatment and then you're like still getting scans for however many years. But I remember on my 5th year, my doctor said, okay, Ricky, you're done. Come back when you're symptomatic. I'm like, what does that mean? Symptomatic how? Like, no way. And I was able to convince him to let me keep doing scans for a few more years until the insurance company said no more. But still, you're out here hanging out. Now I do like the CA-125 blood test, but
So it
right.
is that point where thank you for giving your personal experience, Ricky, where you're absolutely right. What happens after treatment?
Yeah.
Okay, because you have all the resources during that time. And now
Yeah.
treatment has ended.
Mm,
Okay,
mm.
where do we go from here? And then that's what we were talking earlier about cardio-oncology and what's happening long term. What are the long-term effects that may
Right.
occur that we need to dive into? And I'm thankful that we are talking more about survivorship. And sometimes we have a tendency, let's go ahead and treat, absolutely, but then what happens after that? And that's
Right.
where I think that piece is missing or should be expanded, should be talked about even more so, because it's different for a lot of folks.
Yeah, and standardized a bit because sometimes it's not until you have symptoms that things get addressed, right? So we're getting better, I think, at checklists. We have a sexual wellness checklist where we say, hey, listen, do you have certain symptoms? Are you having dryness, et cetera? Do you leak when you giggle? Things like that. But we don't really necessarily have a systematic way of addressing things like cardiotoxicity. We wait till you're short of breath, getting up the stairs, and then it's like, oh yeah, maybe that radiation or maybe that Herceptin really did cause some issues. So I think, I saw at ASCO at least that we're starting to try to figure out how to check for these things up front, but I don't think everybody gets that because nobody has access to those resources.
Absolutely. Yeah. I agree with you. The other area too is just that component of how are you adjusting, right?
Yes.
To
Yeah.
completing treatment, right? How is it for you, right? What does that look like? And that again has to be really teased out. What is that experience for individuals who are now finished with their treatment? And what does that support look like? What is
Mm.
that?
What are you seeing in some of your research? What are some of the responses that you're seeing,
Yeah.
especially in younger women, but in general, give
Yeah.
us a sense of, because it's
Yeah.
not a monolith,
Yeah.
so it's got to be a lot
Yeah.
of variety there.
Yeah, yeah, absolutely. So the cardiovascular is one piece, as well as the sexual health, right?
Mhm. Sexual health
Psychological.
is so huge. Vaginal dryness, all those things, body image, you know.
And also just something that um, it's almost as if it's some that sexual health is not really considered because you're focused on other things, right? But it is important, and it is an important question to ask. And it is something that we should pay more attention to. Also, as well as the fear of recurrence, that is constant, as I mentioned earlier. And also, there is disruption with sleep.
For
There,
sure.
Oh,
there's
that's
the
a big
scan
one. Yes,
anxiety.
indeed.
That's a huge one.
Yeah, yeah, there are. And
What about
so,
appetite? Like, you know what? I really lost my appetite. Like, I never recovered from that chemo taste that you could never eat any food. Like, and part of it is I had thyroid disease after probably from too much chemo, but I've never really gotten my appetite back. It's been almost 15 years,
oh wow,
you know,
oh wow, wow,
no
wow.
interest in food. I eat to
No.
live, not live to eat. And maybe that's just a crazy Ricky thing, but I totally never regained it.
I think some people's taste buds didn't return either. And
Yeah.
so,
Yeah.
right, finding the foods that taste like something you want or foods that you like to make, it's very different, and there's a lot of, I think, fear around nutrition too. People are trying to figure out what they
Yeah.
can
What do
cook,
I eat? Yeah.
what do you eat, right?
And the other evidence too is that individuals are saying that what can I eat that is non-toxic? So more like a clean diet, if you
Oh
will.
yeah.
And so you'll see a lot of individuals that are interested in, what's the clean approach that I should take now that I've completed my chemotherapy. And so nutrition, to your point, is very important as well, because there are some evidence that shows that you want to eat healthier than whatever you ate previously, that you might want to change, just lifestyle changes, right? That can make a difference. And take into account, like you said, taste buds and so forth, but just what can we do again to support individuals who are on this journey for survivorship and really having a quality of life that should be sustained and maintained, and it shouldn't be any difference at all.
Mm,
It should be you can live your life fully and
mm,
recognize that there are some changes that have to be made, but that you are having that sense of joy. You are having that. When I think of stress, I think of eustress, that good stress, right? And you have like Hans Selye and Lazarus. Those are folks that talk about coping and stress. And we do have those distress, but we also need to look at that eustress, that good stress, right? Because that's important as well. I'll stop here.
No, no, because I have questions. I think
Yeah.
this is so on point. Are
I
there
know.
ways to turn stress into eustress, to convert bad stress into good stress? Are there some techniques and things? I mean, it might be beyond the scope of this conversation, but I am curious to know because I feel like people are feeling it politically, financially,
Right.
emotionally, socially, feel lost their jobs. Like, is a lot of stress in the environment right now.
So yeah, there is a lot of stress in the environment right now.
So,
It's a different space. I will say that it is a different space. And so, what I've seen in the literature is you get therapy, cognitive behavioral therapy, and so forth. You get mindfulness. You're in that space where you can grow. Um, Being in a space where you can focus on yourself. So that is exercising, and as I mentioned before, mindfulness. If you like to dance or you listen to music, you really have to kind of take your time to say, what do I enjoy? And facilitate and try to facilitate that, whatever that is in your space, because you're absolutely right. It is very negative, and the environment, right? And so that
yeah.
emotional stress can also be a factor, but we also have to turn around and say, okay, we understand where we are, but what can we do to try to mitigate that? And the evidence shows exercise, sleeping, all of those biobehavioral
Yep.
factors that come into play that you want to do. And it's important that we hone in on that. It's not just saying it, but it's doing it.
Yeah. Yeah, I think one of the things you hit on too is food. Like, Mo really believes, food is medicine, right, Mo? I'm not gonna, you speak to that, on the farm that, what we eat. But I remember, I mean, one of the questions everyone asks us when I finish treatment, okay, what should I eat now? That's always a big question. Like, should I change? And my doctor the only thing she told me was like, stay away from red meat. And that's, well, I eat ice cream a lot. Is it's the same animal? Is it okay to eat the ice cream? And she said, eat the ice cream, don't eat the steak. But still, I think I think we sort of fault ourselves. Did I eat something wrong to cause this? And we didn't. But I think that's our first, you're sitting there trying to figure out, okay, what did I do that could have caused this cancer? And what do I have to change now that I've finished the treatment, right? And like it's, as Black women, okay, it's got to be my fault to some degree, right? Which is crazy for us, but that's how we deal with everything. Like, we try to take the responsibility and accountability for anything that happens, because we're such control freaks. But I think we tell everybody, just take a walk.
Mm.
Just take a walk. Eat some green things and take a walk. But
Yeah, eat more living things, right?
yeah,
Yeah, and breath work. I talk to my patients, especially the ones that have anxiety around scans. We talk about breath work even before surgery, before your infusion, before you go in from that parking lot to go get that scan. Let's take 30 seconds and let's breathe. And it doesn't always work. I've been sitting here today trying to breathe through something, and some days it works, some days it doesn't. But the conscious act of at least trying it and recognizing the stress itself, because I feel like sometimes we just move through life and you don't even realize how stressed you are. Your elbows, your shoulders up to your ears,
Yeah.
and until somebody goes and does that, you don't even realize how much stress you're under. But the thing that I see, Ricky, with this too is
yeah,
about with nutrition and control, right? It goes back to control. What can you control? And I have patients who are coming to see me and they have eliminated every single thing, and
right.
work focus. I said, maybe we talk about what we add in, and maybe we look at it less of a what am I cutting out, but what can I add into my diet? What can I incorporate? What can I control? I said, because I'd rather you drink water and worry about microplastics later than be dehydrated. And we can switch to glass, but if all you have is a plastic bottle, drink the
Drink
water.
it. Drink the
Drink the
water. Drink the water.
water.
Right. Yeah.
Yeah. Yeah.
Yeah.
To your point, there is evidence that shows just movement, whatever that may be for that individual.
Right. Put on
Just
some Michael Jackson and dance in your living room, or even in your car. I dance everywhere, but
it
you
makes a
know,
difference. It really does. It
And it
really.
doesn't have to be quite so prescriptive because I think the
Right.
studies, a lot of especially the exercise physiology ones, yes, structured yoga, yes, structured exercise, but there's other studies that show even just some high intensity, movement for short intervals, right? 5 minute dance party, like you said, maybe a couple times a day. Can you do, take those stairs and get out of breath by taking the
Right,
stairs? And
right, right.
that's the same thing as going to a gym and paying for a membership. I feel like we overcomplicate it a little bit too, maybe.
I
Yeah.
agree. I agree. We have to look at the simple things in life. I always like to tell my patients that I work with, have you gone outside and just listen to the birds, just to
Mm,
be in that environment where you're not focused, you're not on your cell phone, but you're really enjoying that outside experience. And that takes you away from from some of the stresses that you might be experiencing right then and there. So I think we should be a little bit more mindful of sometimes we have it right within our confines, if you will, and that we can utilize that as well. I also want to point out there's some research by Geronimus that talks about the weathering syndrome, where we as Black women have that ability to, as Ricky said, we're 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 doing everything, right? And we're constantly
All the
being,
things.
we're doing everything. We're just we're keeping moving. We're doing everything we are, and that stress level increases, right? So it's almost like a car that's constantly engine is constantly revving up, and that's not good physiologically as well. So we have to step back and recognize that yes, there's that superwoman schema, and yes, we can do it all, but at the same time, when we do it all, what is it doing internally to us? What is hypertension, stress? What does that look like? So I think, have to focus a little bit more on taking care of ourselves and taking care of each other in the space that we're in right now.
Yeah.
what
Yeah.
excites you the most about your research? What is exciting to you now?
Oh, wow. Thank you for that question.
Mhm.
Oh, gosh. Uh, to be honest, working with women that look like me and that those who are um, dealing with breast cancer. And that has always been my area of interest, and it will always be. Now, it's a little challenging right now, okay? Just because, but the work speaks for itself. The science speaks for itself. The evidence speaks for itself. And how can we stop?
Can't stop, won't stop. That's right.
Yeah. Stop, won't stop.
Cannot.
Wow.
And that's why I mentioned the area of heart disease, right? So we want to know a little bit more about that, especially for individuals who have radiation, chemotherapy, and then you're also looking at other predictors as well, other risk factors. And at the end of the day, um, women that I've worked with have said that, I had no idea. I thought that I was going to uh, find out that my cancer has metastasized, but now I have heart failure. And
Right. Right.
I was not informed about that. And so
Right.
what does that even look like? And so we
Right.
believe need to do a better job in just sharing what risk factors
Yeah.
that individuals might be at risk for, but then also um, seeing how we can identify this a little earlier, possibly, and
Yeah.
what we can do to improve their outcomes.
Yeah.
Yeah.
I found with my mom that she's had COPD for many years, 15, 20 years. But in her last years, they told us she had congestive heart failure. Now, did she have it 5 years ago? She probably did. But I think that at some point, especially with older people, they kind of put you in this box where you have this, or you had breast cancer. So anything we look at around you is going to be relative to that, as opposed to, could you have another disease? Right? Right. And it's funny because when I get a funky symptom, I immediately go to the doctor and say, it's my cancer back. Do you know what I mean? But unless you really do that, like I had, Graves' disease, which is hyperthyroidism, probably from a lot of chemo. They really can't say, but I mean, my instinct was to go to my oncologist. But my oncologist, okay, hold on, wait a minute. We did all the testing. I didn't have it, but still, I think people get pigeonholed into this thing that you had cancer, and nobody really says, you know what? Maybe you do have heart disease. Maybe you do have diabetes. Maybe you do have high blood pressure. And if it's not showing up in your blood work, the normal blood work, without you asking, do I have lipoprotein A and have heart disease, hereditary heart disease, you're not going to really know, And that's a whole nother level of stress. I think the stress of just trying to figure out what you have is a whole nother conversation for you. Like, do I have another disease, or did my cancer come back, or what is it? It's always in a stress area of your mind, right?
Yeah. And knowing the questions to ask as well.
Yeah.
That is
Yeah.
very true. I think those question guides that our advocacy groups put out are so helpful, because how do you tease out what it is? I had a patient ask me a really great question today about anti-estrogen therapy, right? The aromatase inhibitors, the estrogen blockers. And they said, well, we know estrogen's good for the heart. So does that mean that blocking estrogen is bad for my heart, doctor?
Mm.
I had to pause. Right? And
Yeah.
I'm like, boy, this is a patient that really won. I mean, because the answer is not necessarily, but
Right.
also we don't entirely know.
Mhm.
And it was such an astute question to think about. Okay, well, I know estrogen protects my heart because the studies show that the estrogen, is cardioprotective. But what
Right.
are the
Right.
going to be the side effects of this pill? And fortunately, I'm a surgeon. I could say, you can talk to the medical oncologist about this one, and kind of shift that responsibility for the larger conversation. But that's not an excuse. Like, I had to be able to answer, pull out some data, and talk about these things. And it was
Right.
a, a difficult conversation that we're probably not having enough with people in terms of what to expect. They call it the latent and the long-term side effects of things. How would you know if you had pulmonary fibrosis? How would you even know if you
Right. How
are
would you know?
getting short of breath getting up the stairs versus, this could be CHF? I don't think we really educate people about that enough either.
Right.
I agree. There's an opportunity, there's a gap there, right? So we need to focus on addressing that. Absolutely. Mhm. I couldn't agree with you more.
So
Absolutely.
tell us more about your research, and what are some of the interesting things that you've shown, and are you recruiting for any trials right now? How can people, get more involved in this if they're watching and say, well, I don't live in California, but I want to do something about this. What do you think
Right.
people should do? So it's a separate questions. I'm sorry, it's too many.
No worries, no worries. Well, first of all, I'm going to advocate for Ricky's team with regards to clinical trials. Number one, that's the first thing, right? We're going to advocate for that. And also, I'm new to my position currently at the university, and so I'm just starting to get situated with regards to my research. And I know now where to reach out to, i.e., for individuals who are interested, who meet the criteria for areas of research that I'm looking at. One in particular that I've mentioned before is that cardio-oncology piece, because I feel that, and it's not only so much I feel, but more of what patients have shared with me, right? Breast cancer survivors have shared. And that is an area that could be further developed for Black women. And why do I say that? Because the evidence shows that there are some risk factors, right? And those risk factors can have an impact on overall treatment. And so we want to highlight those risk factors and see how we can mitigate those, number one. But then two, I also want to get a better understanding of what are the treatments in place ahead of time. Like, how can we mitigate that, right? And I'm still exploring that. So once I'm able to really write the specific aims and write the study, then certainly I could reach out to individuals that may be interested and might meet the criteria. I also would say that there's always an opportunity for collaboration, right?
Well, yeah, I was about to say, we would love to do some of this research with you.
Absolutely would.
And I'm sure that our audience would love to participate and be a part of it. You know, we can always, when you're ready to do it, come back on the show and we'll say, who wants to sign up? You know, but we would love to collaborate and just, you know, to me, we don't have enough data about Black women in any capacity, whether it's about the biology, whether it's about the emotional support, whatever. The more we can get, the more we can study us and our experiences and our cancer is so important. You know, that's why I'm all about clinical trials, whatever we can do to learn more about, you know, us.
Yeah, 100%. I mean, we're here
Yeah,
for the long haul, right?
right. We're
And
here.
so
Yeah.
we recognize that there are disparities, and we recognize that it is up to us and others, collaborators, to make a difference and to really have an impact. And I don't believe that we can do it singularly, right? We need that collaboration. So thank you for that. I appreciate it. I will
Yeah,
absolutely do that.
sure.
Yeah.
For
Yeah,
sure.
and it's such meaningful work that is not a drug trial either. And this is where sometimes people get hung up
Yeah.
on that term clinical trials, right? We think, oh, I'm going to be a guinea pig. But look at this. This is studies
Right.
that looking at, you know, how well people are thriving after treatment. What are the side effects of treatment? How do we improve your sleep? How do we look at your cardiovascular health and give you tools to ask better questions of your doctor? Like this is, I think that to me is really exciting because our community has always felt like things happen to us and about us and around us, but not with us.
With
And this
us,
is
right.
a great way to feel included in something that's going to directly impact your wellness, not just your disease, you know?
Yeah.
100%
Yeah.
along that trajectory, that survivorship trajectory, right? That's
Right.
Yeah.
that's exactly it. Because
Yeah.
it does take more and it makes a difference. And I, I I always tell folks, they're like, well, do you have a lab? And I'm like, well, the community is my lab. How about that? The
Wow.
community is my lab. Yeah.
Wow.
Yeah.
Stephanie just sent me a text because I guess she was having trouble getting a comment on YouTube. She said, um, weight gain is related to low estrogen. Then we learn we need estrogen to lose weight. What's that about? From our friend Stephanie Walker.
Well, I don't know, Doc, you have any thoughts on that? And I can share mine too, but you know, if you have anything that you've read or studied or aware of, you know, it's a hot topic for sure.
It is a hot topic that really, I think she raised a good point. And I would say that it is kind of confusing, right? It's like, well, wait a minute, what do you mean? It's like we need this, but yet we
Right. It's
we're
causing this.
told,
Right.
yeah.
Yeah.
So
Yeah.
I think there's more research that needs to be done. I would say that. And I will absolutely look into that a little bit further. But I would say that overall, when we think about the benefit of the actual treatment, I think that's really something that we need to take into consideration. What's the benefit? I'll have Dr. Mill go ahead now.
Sure. No, you're right. And sometimes and most times the benefit outweighs the risk. But what I think we're learning from even like the GLP-1 studies is I think we're learning that it's not just estrogen, but it's hormonal imbalance, right? There's a whole endocrine system that's related to blood sugar, related to cortisol and stress and growth factors, and all those things are all working together in a very intricate dance. And when one or two gets out of whack, everybody, you know, if you're doing a line dance and two people get going the wrong way,
All right.
the
You're
whole
gonna
dance
crash. You're gonna
is
crash, right?
going on. Exactly. And I think what we're seeing is that some of the drugs in particular are helping to balance out multiple things, but it speaks to the need to move our bodies, to look at our diet, to look at ways to, it's the effect of the drug, not the drugs themselves, right? And that is something that we can lean into as well. So I agree with you, Dr. Davis, when you say, you know, more to come. We're going to see a lot more than just observational studies on all of this, but it's more than just estrogen also. So don't put it all
Yeah.
on estrogen. Okay, by blocking my
Right.
estrogen, now decreasing my ability to lose weight. It's the other metabolic effects of some of those medications too.
Right. Right. Well, it's funny, you know, I had all my friends at my, houses for my mom's funeral. And so, we're all old now. And so my college roommates and my old friends. And so I'm like, y'all are looking really good. Like, how'd you guys get this weight? They're all taking GLP-1s and they all are taking like, well, I'm taking this special compound that's like not the brand name, but my doctor created like they're all like, I mean, it's like all of them. I'm like, I'm the only one. Wait a minute, maybe I'm doing something. But it's definitely a topic. I'm like, well, you guys, we don't really know the long-term effect of these. Are you going to take it for the rest of your life? Are you sure this is the right thing to do? And one of my best friends, she had her kidney replaced. She has her daughter's kidney, like, and her kidney doctor said, this is probably one of the best drugs you'll ever take. He took her off for the kidney meds and put her on GLP-1. So that whole science, though, to me scares me a little bit because I don't think we have any data about it for Black women. And is it like a temporary blip? I mean, I think they've been around for a while, so I guess they're okay, but how do we know what the long-term effect for Black people, could be? I don't know.
I think it's more to come, to be honest, because we don't know right now and it's fairly new. And I'm I would say that it's nice that your friends have done that and they're looking fantastic, and that's a good thing. But at the same time, we also need to expand and really get an understanding of how does it affect individuals long term. And
I don't think I want to commit to taking something for the rest of my life,
yeah.
every day, a shot or whatever, every week or whatever. I'm not sure if I want to sign up for that.
I think I'm
Yeah.
hoping that, like other medications, like metformin and others, that it could be a bridge to, maybe come off a medication, but it only does that in the presence of lifestyle modifications that I don't know that we always talk about, focus on, or make accessible to people. So I think we probably need to do let's say a concomitant job of not only studying the effects of the drug, but also looking at the processes by which people can sustain the weight loss, the glycemic
Right,
control,
right,
whatever the things are. And I don't know, I'm sure those studies are happening, but hopefully they're happening with us, with our diet, with our
right,
lifestyle, with our
right,
budgets, with our stressors.
right,
And
right.
don't know yet.
Right, right. Yeah, yeah. We'll see. I guess the jury's out, but we do know that, I mean, we talked to Dr. Coralmini and a couple people that said that, GLP-1s are helping with cancer to minimize cancer recurrence, with the exception of triple negative. But that data is proving out, but still, again, we don't have a lot of data with Black women. So
So
more
the
to come.
study, I didn't mean to interrupt. So just to clarify, you're saying that there is a correlation now with
Yes,
what?
we have some data that
Nice.
shows that GLP-1s do help with minimize cancer recurrence, with the exception of TNBC, triple negative.
Which is very prominent for Black women.
We get it 3 times already. So,
Right. Okay.
And there's observational studies also looking at GLP-1s to reduce the risk of even developing a first cancer. That was a study that came out of Penn. That was the big late-breaking ASCO podium session. But
yeah,
again, observation and correlation doesn't equal causation either, because we are yet finding that there could be a hormonal component to triple negative that we don't know of, right? Androgen pathway and other things.
right,
So,
right,
who's to say?
right.
Yeah.
Okay, so much more data to get. But all right, I want to go back to the basics for a minute before we close out. What exactly is stress? I mean, like, I'm so stressed out. Well, what are you talking about? Like, what, you know what I mean? Like, how do you know if you have it? Because some people ignore it and some people live in it as an excuse for everything.
Yes, yes, absolutely. So it's like that physiological stress that you can almost like that flight a fight response where you feel very nervous and you can physiologically you might have your heart starts to palpate, you might start to sweat, you might get very diaphoretic, and also you might
Exactly.
see where there's also that dry oral mucosa where you might not salivate, but you might have that dry mouth, if you will, right?
Mhm.
And so you are in that fight or flight response, if you will, and you're very stressed out. Your heart rate is increased, etc. And that is physiological. But then that psychological component is where you feel a little anxious. You have anxiety, you have some distress. So it's both components. right? And it's evident sometimes by the physiological mechanism that I just mentioned, where you have hypertension or high blood pressure at a moment. You might have, again, tachycardia, fast heart rate. You start to become diaphoretic. So stress is also, in addition to the physiological component, stress is also where individuals might have other symptoms, such as a stress headache, right? As you were touching your head, where you just feel very, very nervous and you feel anxious. And so that is where that distress comes in. And that's why at the beginning of our show, I talked about having that eustress, that good stress, that balance, right? So that it's not so focused on all of that components that will make you even more upset or more depressed. There's there are tools that we can assess anxiety and depression, right? There are questions that we can ask. How's your day? Right? There are questions that we can say, has this been an ongoing experience for you? And then based on that tool, we can also give treatment and or therapy.
So everybody feels it at some point, but you bounce back from it or not, right?
That's the whole idea, is that you want to be resilient, right? You want to show resilience, and that, it's almost like we're stretched, right? And then how much can that stretching impact our lives, right? So how much does that stress impact your life so that it incapacitates you? Or you recognize, this is stressful for now, but this is what I'm going to do to get through, right? So you have those resources in place, whether it be your spirituality, whether it be you have a friend that you can talk things to, whether it be journaling, whether it be in this space right now where we're sharing our experiences. All of that comes into play.
Or you ignore it and it manifests as illness in your body, right? Which is another stress response that we probably don't talk about either. There's some people who don't, they try not to allow stress to impact them or to manifest at all, but it always does. And looking at how Black women especially experience stress, right? We may not snap at people. We may not shut down. We probably don't close the door. We probably just keep moving, and we become hyper productive, and then start working on 5 and 6 projects, and next thing you know, and it's an overachievement response that I think Black women especially, we dig in, right? When we get stressed, what do? We work harder. And it
Here we
isn't
go.
always
Yeah,
right?
here we go.
Hot kettle, hot kettle
Yeah.
black, right?
Yeah, we just dig in more. I mean, well, I really do believe stress caused my breast cancer because I internalized it, you know,
Yeah.
really do.
Well, but, I want you to take that on, right? Because I feel like, yes, we can manage things differently, but so many people feel like something they did caused their breast cancer. And it's like,
Yeah.
no, this is what we can do to take back some control, not focus on the source, but look forward more than backwards, I think. And for me, that's what survivorship is kind of about, right? It's not looking at what was, but looking at what is and what could be, and how do we move in that direction, I guess.
Right.
Yeah.
Absolutely. And then we know also that 85% of cancer is environmental, right? And so we have to consider that as well. And then you have, your 10% that's genetic and 5% is unknown. And so what does that environmental piece look like for each and every one?
Yeah.
Wow.
Yeah. Yep. Steph brought up another question too, the stress of being metastatic.
Oh, yeah. Yeah.
That's survivorship too. What are they, sort of how do you deal with all of the emotions that sort of go along with that? We did this retreat with Whitney a couple of weeks ago, I guess a month ago now. We had 8 young metastatic women who had gotten breast cancer under 40, and 2 of them stopped taking the tamoxifen, had a recurrence metastatic. So you can only imagine the stress they were feeling.
Yeah.
We talked a lot about it in the moment, but it was pretty, guilt ridden. And like, did I do this to myself? Could I have controlled this differently? And it's similar to like, did I eat the right thing? But if I had taken the meds, what would have happened, right? So
Yeah.
I don't know if there's an answer, just to like, I
I think
think
just
everybody has to
acknowledging
sort
the
of find,
weight of that,
yeah,
acknowledging the very weight of that stress, because it's a different stress
it
than is
is.
my cancer going to come back. It's like, no, this cancer is always going to be with me in some form or fashion, right? And how do I make room for this roommate that, this
Right,
very
right. It's not
uninvited
gonna
guest,
leave. Right,
right? This very uninvited guest that now isn't going to leave. So I don't look forward to the same things. And so even like goal setting is different. Because goals might look different, right? Because treatment may not end. But I mean,
right,
ultimately, finding no evidence of disease is sure everybody's goal. But how do I set intermediate goals that source joy in the meantime?
right,
So that is a different set of survivorship goals that support groups don't always
right,
address.
right, right, for sure, for
You
sure.
know, that's a really good point, and I think that that's an area that should be expanded with regards to research for Black women that have metastasis, and that we need to know more. We need to really get their voice and their sense of this experience, and it is a different survivorship. And at the same time, I think that um, there is an opportunity for us to learn, because it is something that sometimes
Dealing with,
it's not
yeah,
expanded. It's not, we need more. I would say we need more information. We need more data. We need more studies. We need to get their experiences. Yeah, yeah. I'm gonna make a note on that. How about that?
I love that. Let's do it. That could be another study we do together,
Yeah.
I know we're building a mental health tool with Whitney O'Connor, the Booby Queens, it'll be on their website with a link from ours with some tools for mental health
Okay.
for
That's great.
metastatic women. So that should be up in a couple of weeks.
That's
Excellent.
great.
So
Let us
but
know if
we'll,
we can
we'll
contribute to
build on
that
it.
too.
Hmm?
Yeah, because we did our metastatic retreat here. We had about 12
Yeah,
women
it
also.
was the same day. We did them on the same time. Remember that,
We
Mo?
sure
Yeah.
did. We should combine our data though. We should look at
No,
how
I
to
know.
support.
We'll do that. Let's do
I
that.
love it. I love it. Dr. Claudia, what advice would you give people who are watching and they're like, you know what, I'm feeling it. I feel it here. I feel it here. I feel it here. I feel it here. If there was some tools or tips that people could take away, what would that be for them? What do you think?
Sure. So I would say first and foremost, try to release that stress, right? And absolutely. And whatever movement, and again, I cannot stress exercise
Okay.
and
Right.
movement and yoga.
Moving your body. Yeah.
Move your body. And I would
Wow.
also say be in a space where you can find a sense of peace, whatever that is for you, right? And so if that is spending time with your friends, right? Just being in that room, going out to lunch, whatever it is that gives you joy, find that. And be in a space where others are giving you support as well. And if it's with your family, if it's with your friends, whatever that is, to elevate that cortisol level, right? That's what we want. That's the numbers there. And I would also say that for individuals who are spiritual, right? And that
Mhm.
component is important as well, that's where you find your space where you can feel that
Find peace.
this is where this is where you want to really get some strength back. Then I would also state that be in tune with your body. And if you sense that there's something that's not right, get it checked out.
Yeah.
Right?
Yeah.
Absolutely get it checked out. Yeah. And laughter is important.
Laughter is critical,
Yeah.
right? Try to laugh every day. I know one of my prescriptions for my oncologist was to watch a funny show every day. So the whole time I was on treatment, I watched I Love Lucy every day. Like I watched that chocolate episode, I don't know how many times, but
That's
because
so
that was
funny because I use that episode to talk about what cancer is and how it develops. And I'm getting to the point now where not enough of my patients have seen I Love Lucy. And I
I
said,
know,
boy,
right?
I,
We're
I
really
mean, I started looking at these grades and I said, I feel old because
I
people,
feel
I'm like, you ever watch that episode of I Love Lucy with the chocolates? And the
yeah.
women of a certain age get it. But the young ones, they're like,
I have no idea who she is.
I love who?
I know, but when you show it to them, they crack up, right?
Yeah, yeah,
Yeah.
it's still good for sure.
Yeah.
Thank you so much, Dr. Claudia,
Thank
for
you
being
so
here.
much, Dr.
You know, I
Claudia.
know
You're
you
now in
got
our
our
family, you know, when we scoop you
oh
up,
yeah.
you're done.
Yeah, yeah, it's research collaborations from here, so
Oh, wonderful.
between Touch and the farm and the work we're doing here, and Meals Movement and Mindset and Survivorship, we would love to partner with you and
Yeah,
really help to, continue to expand the work that you're doing at such a time as this when we know what's happening to grants and funding and research that is tailored to looking at this particular issue for us especially. So you got friends and support.
Thank
yeah,
you. I appreciate that. Absolutely. I really do.
yeah.
It's heartwarming for sure. It really is. The work
Right.
continues, and it's nice to have that support and the collaborations, and that we can make a difference.
We can make a
Right.
difference. We're
Yes.
right here. We can make a difference. We try every day to make a difference, don't we, Mo?
We do, we
Yeah,
do,
in whatever way we can.
Yeah. And I'm so glad, Ricky, that we met. It was just
I
serendipitous.
know.
It was just so serendipitous at this
Yeah,
conference that we just
yeah.
kind of said, "Who are you? And where are you at?" And it really was a wonderful experience. So
It's
I'm
great.
thankful, grateful as well. And Mo as well. How about that?
Yeah,
Yes, it's lovely to
I know.
meet you. I might make it out this year. I'm gonna try to make it out to the conference for the next one. So yeah, I'll see you
Yeah,
there.
we kind of are a package deal sometimes, huh, Mo?
Listen, we are. God put us together, and that's just that with that. So, we're
Yeah,
gonna keep this train moving every Wednesday
yeah,
night on whatever platforms God sends us, YouTube, Black Doctor, all the things, our own
right.
network, streaming platforms. Listen, the message
Right
has
here.
to continue,
And we'll
right?
get it out there somehow, some way, every week.
That's it.
Every week.
Yeah, it's what we
That's
set
good.
out to do. We hope it's relatable, reliable, and real. If we meet that criteria, then we're doing our job.
Yeah,
We've
yeah.
done it.
We've done it. We've done it. Bless you, love.
Yes, yes,
Yeah.
absolutely.
Bless you,
Absolutely.
love. Thanks for everything. There we go.
Yeah.
Take care. There we go.
All
Love you,
right.
Mo. Love you, Claudia. Thank you.
Love you.
Bye.